Hi there. Thank you once again for joining me on the program, Your Doctor and COVID. I'm your host, Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. Once again, we continue our discussions around the COVID-19 pandemic, and in particular, we're talking today with Dr. Hemchan Baran, who's a nephrologist. That's an area of medicine that deals specifically with the kidney and the kidney diseases. And in the era of COVID-19, we are finding out that this virus can affect the entire body, and the kidney is one of the major organs that are affected as well. Remember, if you have any questions or comments, please feel free to send us a WhatsApp message to 620-6275. Or you may send an email to docandcovid@gmail.com. So once again, we'd like to welcome Dr. Baran onto the program. And for the rest of this program, we will take our masks off because we are more than 7 feet away from each other. So welcome, Dr. Baran, and thank you again for joining us.
Thank you, Dr. Carpen.
So let's get straight into this. How does COVID affect the kidneys? Is there any special way that COVID affects the kidney that's different from, let's say, diabetes, hypertension, anything else? Tell us about the specifics for COVID.
Okay. So I have watched your programs, and you would have mentioned previously the mechanism of how COVID affects the respiratory system and the cardiovascular system in particular. It's no more different how it affects the kidney. The mechanism is quite similar with the virus. Once it attacks the body, there are these specific things we call receptors that receive the virus and attach to the organ. The kidneys do have these receptors.
And these are the ACE2 receptors?
That's the ACE2 receptors, correct. Yes. Because the kidney have these receptors, it's more prone also to kidney injury. There are two ways the COVID can produce kidney injury, and it can affect the kidneys directly or indirectly. Directly in the sense that the virus itself causes a huge inflammatory process. That's like when the body responds to an infection, and the inflammation alone can cause harm to the kidneys. The indirect way is when it affects other organs, for example, the heart, and if it causes a heart failure, indirectly it can affect the kidneys, and that produces kidney injury also. Yeah. So there are several ways in which the COVID contribute to kidney disease and kidney injury.
So there's a direct way and an indirect way.
Indirect way, correct.
Okay, so thank you very much for clarifying that and for sharing, how this is actually happening here. Any special way in which we are managing the COVID patient with kidney disease versus the non-COVID patient with kidney disease? Any special precautions that we have to take?
Once they're diagnosed with COVID, they receive the same treatment as specific for COVID, if they are antivirals and the specific symptomatic treatment. When it comes to kidney injury, the doctors, they would know to avoid using certain medications to produce more kidney injury. Okay. And here is where they would be more cautious when it comes to the kidney, once there is a kidney injury. They would have already contacted me or another doctor once they detect that there is also a kidney injury. They would be on the lookout for signs and symptoms, and they would look at the blood test results for the progression of kidney injury and the need for more aggressive treatment. And the main thing here is the symptoms of kidney injury. An acute kidney injury can produce symptoms of, for example, or signs of high blood pressure,
Right.
toxic picture, as I mentioned earlier in a previous program. They can become toxic or uremic, and a lot of derangement with the electrolytes or elements, as I mentioned previously.
Yeah, these
So
are the minerals in the body.
Minerals.
Yeah.
So they would look at all of these things, and it would give us a fair idea how severe is the kidney injury, and whether this patient would, be needing dialysis very soon or not.
Yeah.
So a lot of caution is being placed once there is detection of kidney injury. Another thing that I would advise also for them to look at is if they only find any protein in the urine. It's a new term. They would need to pay attention to that also, because one of the mechanism, as I mentioned, COVID can produce the substance I mentioned, protein in the urine,
Yes.
and it might only be the only form of kidney injury.
To see protein
In the urine.
Interesting. So we have in Guyana a lot of patients who have hypertension, as high blood pressure. And a lot of these patients are on medications that we classify as ACE inhibitors. These are our ramipril, captopril, etc. All the medication that ends with pril in their name. And a lot of them are also on the medications that are like losartan, valsartan, etc. Those are related to the same receptors that you mentioned before that the virus uses to enter into the cells. Is there any recommendations, in your opinion, about using those medications in the COVID era as it relates to the kidney disease patients?
Okay, I'm glad you asked that question. I actually presented a paper just before I returned home on that specific area. And I looked at about 3 papers, and it was up to June of last year. Maybe there is more data coming out on this area now, but from what I have presented and read so far, the use of these medication and blocking these receptors, there were no changes actually stopping them, because it was advised previously that for the hypertensive patient to stop these medication because of the mechanism of how the COVID and these receptors react. There was no evidence to show that stopping these medications might help, or even placing patients on these types of medication to block the receptors might help with prevention or ease the disease burden of COVID.
Okay.
So to date, there is no evidence to support stopping the medication or starting it.
Okay.
But what is there is patients who are previously on these medication, it's advised not to stop these medication.
So that's very important for us to emphasize, that if you are hypertensive and you are taking an ACE inhibitor or an ARB, which is either the captopril, ramipril, or losartan, etc. If you are hypertensive and already taking those medications, there is no recommendation for you to stop it as a patient during COVID.
No, correct. You're correct.
Okay, thank you very much, because it's a lot of patients have asked that question. A lot of forum online, people are discussing these things. A lot of them are patient-centered, patient-related information that is being shared, and I'm glad that you were able to clarify that with some level of certainty and a definitive answer. So to our patients, our viewers and listeners who are hypertensive and you are taking medications such as ramipril or captopril or losartan, there is no need, there is no evidence to suggest that you should stop or modify the way you are using your treatment at this time. So thank you very much for that part.
May I add something also?
Of course.
So for my viewers, as Dr. Carpen mentioned, you don't stop these medications if you are normal at home, but if you happen to get sick and you think you need medical advice or medical attention, and you're having, for example, diarrhea or vomiting and your blood pressure is getting too low, then you would need to seek advice from your doctor about this. At the same time, we advise you not to stop these medications. If it so happened that you got sick and you happen to have a kidney injury, then that's the moment when we would advise you how to take these type of medication.
Thank you, Dr. Barrett. Now, during this era again, is there any trends or patterns that you have noticed in kidney disease in patients with or without COVID? Anything that you've noticed, anything stood out? I know you mentioned in a previous episode that you have more patients coming in with kidney disease. Are there any other trends or so that you would have noticed?
I looked at different areas with chronic diseases, patients with chronic diseases in regards to COVID and worsening kidney disease in regards to COVID. I have noticed more so our hypertensive diabetic patients. They would have more rapid, progressive, or worsening kidney disease once they're tested positive with COVID. I notice that trend has been there all the time, and it's no different from the data I see in the Caribbean and around the world. Our diabetic patients are at higher risk of progression of kidney disease in this area. The other thing I notice also, when it comes to COVID and kidney disease, we don't pay much attention, but as I mentioned earlier, there might be asymptomatic patients who only presented with a urine analysis or a urine test showing that protein in it. I have seen quite a few patients just presenting with that protein
in the urine.
And it has been on the increase also.
Okay. Are there any specific features of kidney disease in the COVID patient? Any, or general, what are some of the complaints people would have who have kidney disease before you actually do the test to confirm, okay, you have kidney disease? What do these people complain of?
It's a bit unfortunate for me as a nephrologist and a kidney doctor addressing these patients. Why I said unfortunate? Because I might not be the first person to see these patients. They would have gone to different doctors or seek medical attention other locations before coming to me. Maybe I had one or two patients who came directly to me, diagnosing them with some form of kidney injury that I would have sent to get COVID testing done. But most of my patients, or most of the patients that would have been referred to me with a positive COVID test, they would present in two ways: asymptomatic or without any symptoms, and the testing might just show that there is abnormal kidney function, and the urine might show that there is a little bit of blood or protein in the urine, and the test is positive for COVID. And this I notice in the younger population and patients without any previous history. I would notice this in this category of patient. And then the other category would be the symptomatic patients who most of the times would have an underlying chronic disease, maybe especially diabetes or hypertension. And they would start it with vomiting, feeling nauseous. They might be losing some weight, loss of appetite. They might have some sleepless nights,
Right.
those things. And most times they started to notice swell in the legs, and they might have some trouble breathing. And these are late findings. That's why I said these patients would come to me at a later stage.
Okay. So hopefully, you know, as we go further and more of the population becomes educated, that we will seek earlier attention. Patients would be brought to your attention and the attention of the appropriate healthcare professionals at a much earlier stage, so that they do not need, you know, the advanced kidney therapies like dialysis or transplant, etc. So I want to thank you very much, Dr. Barron, for taking the time for the past 3 days to sit and talk to us about your specialty of nephrology as it relates to the COVID-19 era. And we wish you all the best in your endeavors to continue providing nephrology care to the people of Guyana. Thank you very much once again for joining us. And to you, our viewers and listeners, thank you for listening, thank you for watching. And remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you very much. Thanks, Dr. Barron.
Thank you, Dr. Carpen.